The testing process for motorists in Rwanda's capital is not taking more than 5 minutes per individual, randomly stopped, and their contact information is also collected. It's quick, and I believe that if it were to be done for all people in Rwanda, it would help. We don't find anything wrong with this, and this is the first time we're getting tested for COVID-19, so it will at least help us to know our status and give us confidence about our health. I want to know my status pertaining to that illness, if I have it or not, because this is mass testing. Many people are going to find out their status. This is good, very good. I am only able to work when I am healthy. If I were to be sick, it would be of no use anyway. So I am happy that I can work because I am healthy. It will also help me to urge others to protect themselves. That way it increases my chances of remaining healthy.
Joining me now is Congresswoman Donna Shalala.
Rwanda's efforts to fight the spread of COVID-19 have not gone unnoticed in other parts of the world.
9,000 new cases in one day, 29,000 in the last 7 days. It's a disaster. And it's a catastrophic failure of leadership, of our governor, of our president. The mayors are scrambling to try to do the right thing. We don't have contact tracers, as you pointed out. Listen, Rwanda in Africa has 12 million people. They have 60,000 contact tracers. 60,000 contact tracers. We're not even in the ballgame. And I said months ago, the worst thing that could happen to us is that we'd have to close down again. If you don't starve the virus from the beginning, if you don't hit it with a hammer and with everything you've got, you end up where we are today.
Officials at the Rwanda Biomedical Center have explained why this method of testing was chosen. This is different from looking for and isolating infected individuals for treatment. This is similar to research, and we cannot identify positive cases right away, and we cannot expect everybody we test to wait for the results to become available. This gives you a sort of picture of the pandemic in a given area during a certain time. When we do identify a sick person, because we have their contact information, including the address, a team is dispatched from the tracers. This team is not supposed to hold people, just give us that picture we need to determine the state of the pandemic in this area. Sick individuals are treated, and any other individuals he or she came into contact with are also traced. The goal is to test 5,000 people in 2 weeks at a cost of between $50 and $100 each, money that is being provided by the government. As of Wednesday, 147,904 COVID-19 tests had been conducted in Rwanda since the pandemic began, with 1,042 infections, 480 recoveries, and 559 active cases. 3 people have died from the pandemic.